Shocking truths about 85% of heart attacks and strokes that almost no one talks about. The real cause isn't what you've been told. It's not just cholesterol. It's not slow calcium buildup or decades of plaque gradually clogging your arteries. The shocking truth is this: most fatal heart attacks and strokes are caused by a blood clot, not plaque. Don't let anyone tell you you'll die just because your cholesterol is clogging your arteries. That's not what kills you. The real killer is a blood clot that can form in less than 5 seconds and instantly block blood flow to your brain or heart without warning. The scariest part? Most people don't even know they're walking around with one until it's too late. Blood clots, the hidden threat in your circulatory system. Today, we're going to break it all down. What is a blood clot really? And more importantly, how can you stop it before it stops you? Let's be clear, not all blood clots are bad. In fact, they're part of your body's natural healing system. When a blood vessel is injured, your body forms a clot to seal the leak, like a biological band-aid. Then, once it's done its job, your body normally dissolves it on its own. The problem starts when something goes wrong with that system. The clot doesn't dissolve, or it forms in the wrong place at the wrong time, and that's when disaster begins. Sometimes it starts with tiny micro tears in your artery walls, which you don't feel at all, until the clot forms, blocks blood flow, and turns deadly in seconds. So how do you know if you're at risk? Here are the warning signs. 1. Deep vein thrombosis, DVT, clot in the leg or arm. Look out for swelling in one leg or arm, cramping pain that feels like a Charlie horse, skin that feels warm to the touch, redness or bluish tint in the affected area. 2. Pulmonary embolism, PE, clot in the lungs. This is an emergency. Symptoms include sudden shortness of breath, chest pain that gets worse when you breathe deeply, fast heartbeat, coughing up blood, feeling lightheaded or like you're going to pass out. 3. Heart attack, clot, blocking the coronary artery. Watch for chest pain or tightness, pain radiating to your left arm, neck, jaw, or shoulder, shortness of breath, cold sweats, nausea or extreme fatigue. Early detection is the only way to take back control of your life. And in this next part, we'll break down how to stop blood clots at the source, before they stop you. But first, when a blood clot strikes your brain and causes a stroke, the most important thing you can do is recognize the symptoms. FAST, F-A-S-T, stroke. Warning signs, F, face. One side of the face droops. The smile is uneven. A, arm. One arm is weak or numb. The person can't lift both arms evenly. S, speech. Slurred or strange speech, or unable to speak at all. T, time. If you see any of these signs, call 911 immediately. Also, don't ignore other red flags like sudden, severe headache, dizziness, loss of balance or coordination. The real trigger behind blood clots isn't cholesterol or calcium. Most people believe cholesterol or calcium buildup is the root cause of dangerous blood clots. But the truth is far more complex and more urgent. The real trigger? Chronic inflammation inside your body. When your blood vessels are inflamed, your body goes into defense mode, activating clotting mechanisms even when there's no injury. That's how clots form in the wrong place at the wrong time, leading to heart attack or stroke. Top inflammatory triggers that promote blood clots. 1. Cigarette smoke. Toxic chemicals from smoking directly inflame the blood vessel lining, damaging the endothelium and creating the perfect storm for clot formation. Even secondhand smoke is dangerous. And no, vaping is not a safe alternative. Vape aerosols can trigger the same inflammatory response as cigarettes. 2. Alcohol. Yes, even in moderation. Your liver sees alcohol as a toxin. Even small amounts can disrupt blood chemistry, irritate vessel walls and increase clot risk. 3. Hormonal changes. Birth control pills and hormone replacement therapy, HRT, can thicken your blood by altering hormone levels, raising stroke and clot risks in certain individuals. 4. Psychological stress. The broken heart syndrome. Did you know your risk of heart attack can increase by 2,000% after losing a loved one? Intense stress disrupts your nervous and hormonal systems, triggering abnormal clotting, even without any physical cause. 5. Surgery, overtraining, and poor diet. Major surgery and overexertion, like marathon running, trigger widespread inflammation. Refined carbs and sugary diets? Same story. That's why people with diabetes have a 4 to 5 times higher risk of blood clots. 6. Chronic infections. Silent infections, especially in the mouth, gum disease, abscesses, or undiagnosed bacteria hiding in the body, can quietly fuel inflammation, creating a ticking time bomb. Sugar and calcium. The hidden triggers behind dangerous blood clots. For many people, the root cause of blood clots isn't some rare condition. It's something far more common: high blood sugar from a diet loaded with refined carbs and sugar. Here's how it works. When your blood sugar levels spike, your blood becomes thicker and stickier. At the same time, it fuels chronic inflammation throughout the body. And remember, inflammation is one of the strongest triggers of clot formation. But there's another overlooked threat: excess calcium in your arteries. Surprising studies have shown that postmenopausal women who take too much calcium to support their bones actually face a higher risk of blood clots. Why? Because calcium plays a role in more than 15 clotting factors in your blood. Too much calcium in the wrong places can deposit into soft tissues, especially arterial walls, leading to calcification, stiff arteries, and greater damage under stress. So what's the solution? Vitamin K2 may be the key. Think of it as a calcium traffic director. It helps guide calcium to where it belongs, your bones and teeth, and keeps it out of your arteries, where it doesn't belong. Where can you get natural vitamin K2? From nutrient-rich whole foods, including natto, traditional Japanese fermented soybeans, pasture-raised egg yolks, butter from grass-fed cows, organ meats, like liver. These high-fat, whole food sources were once misunderstood, but they're now known to be rich in natural K2 that helps keep your arteries clean and flexible. The Vascular Protection Trio: vitamin D, K2, and magnesium. Here's something you should never forget. Vitamin D and K2 are a team, and they only work best together. Vitamin D helps your body absorb calcium from food, but without enough vitamin K2, that calcium can end up in the wrong places, like your arteries, where it contributes to plaque buildup and increases your risk of dangerous blood clots. K2 makes sure that calcium is delivered to the right address, your bones and teeth, not your arteries. But the benefits go deeper. Vitamin D is also a powerful anti-inflammatory, playing a key role in protecting the endothelium, the delicate lining of your blood vessels, which is exactly where most blood clots begin to form. Next up, magnesium, the often overlooked mineral most people are missing. Magnesium acts like a calcium gatekeeper. It prevents excess calcium from flooding into soft tissues and artery walls. It helps relax blood vessels, improving blood flow. And critically, it helps prevent heart rhythm disorders like atrial fibrillation, AFib, a common cause of clots forming in the heart. And there's one more key player: nitric oxide, your body's natural vascular miracle molecule. Produced by your own cells, nitric oxide helps dilate blood vessels, keep blood flowing smoothly, prevent platelets from sticking together, one of the body's most powerful natural defenses against clot formation.